The Chief Medical Director of the Federal Medical Center, FMC Asaba, Dr. Victor Osiatuma, joins us on the program right now via Skype. We'd like to welcome you to the program.
Thank you. Good evening.
Let's begin with, since the index case, and this is index case recorded in Delta, what's your observation of the COVID-19 response so far?
Well, since the index case that was identified a little over 6 weeks ago, the cases have continued to increase. The response has been fantastic, but maybe because of the behavior of our people, the number has been on the increase. And so we've been battling to ensure that we care for all those who have been affected.
When you look at the rising cases, are you alarmed by it? And when you talk about the behavior of the people, you're saying they're not taking responsibility, our government's efforts towards sensitization, anything to go by?
The sensitization has been high, it's been adequate, but still a lot of people don't believe COVID-19 is real. And so you see the way they behave in the banks, you see the way they behave at the bus stations, the way they behave at the markets. It obviously shows that they are not aware that they are in danger. And that's why the number is rising. If we can keep to the simple instructions that have been laid down, the protocols that have been laid down of simple social distancing, washing of our hands, ensuring we wear our face masks and all that, I think we can break the cycle. But right now, a lot of people are not complying, and that's part of the problem.
Tell us a bit more about the role the FMC is playing in the COVID-19 fight. We understand you're managing some of the cases in Delta State.
We have one of the 4 treatment centers in Delta State, and we have quite a number of patients. The treatment center is full as I speak. We have discharged well over 25 of the patients, but we are full right now. And in addition to that, we still have the main hospital to run. And quite a number of these patients have been picked up in the main hospital. They present at the emergencies, they present at the general outpatient clinics. And so the staff are also exposed. Even those that are not wearing PPEs, they are exposed as well. So the function is dual, running an isolation center as well as picking up the patients as they present at the emergencies.
So in terms of that effort, are some of your healthcare workers infected? What other obstacles do you face in managing the cases?
Well, some of the obstacles we're facing is that, one, our manpower is going down. As I speak today, over 20 of our staff has been infected. We have treated quite a number of them, at least 15 of them or so have been treated successfully. They've been discharged, they've gone home. But during those times that they are being treated, they are not available to work. And immediately after discharge, they cannot return to work. So they need to get some time off to get treated. That's one. Secondly, with the coming of the isolation center, you see you have to deploy some staff. Not less than 50 of our staff have been deployed to the isolation center. Some are being used for contact tracing, some are being used for screening at the gates and all that. So quite a number of staff have been pulled out from the general pool you need to render service. So right now we are getting short of manpower, and so it would be nice if we can get some additional hands, maybe as volunteers or new staff to join the fight, because as they get infected, as the days go by, the number is depleting. That is one. Secondly, the challenge of finance is there. Finance because even though the federal government is supporting us with consumables, the state is supporting us with a lot of consumables, PPEs and all that, but still you find that taking care of these patients requires a lot. You have to feed them, you have to manage particularly the comorbidities that they present with. Most times you are battling with the morbidities and not even the COVID itself. Some patients come in with renal failure, some come in with chronic anemias, some come in with cancer and all of that. And as you're managing the COVID, you have to manage these morbidities. If not, that's what they're going to succumb to. So it's a challenge having to provide these expensive drugs for them that are not part of the routine drugs we use for the treatment of COVID. So that, of course, is also contributing in depleting the internal generated revenue of the hospital.
All right. We hope that government can rise up to the challenges and also private individuals, private sector. We'd like to thank you. Wish you all the best. The Chief Medical Director of the Federal Medical Center, FMC Asaba, Dr. Victor Osayatuma. Thank you for joining us.
Thank you, and God bless.